Welcome to this video about how to have climate conversations within a clinical setting. I'm Dr. Teddy Potter, a clinical professor and director of planetary health in the School of Nursing at the University of Minnesota. The World Health Organization states that climate change is the single biggest health threat facing humanity. Yet far too few clinicians are talking about the health impacts with their patients. It's often said that with climate change we're all in the same boat, when in fact we're all in the same ocean but different boats. A luxury liner will weather a storm differently than a canoe. Not everyone experiences the health impacts of climate change equally. Climate change amplifies health disparities so that populations contributing the least to climate change, including Black, Indigenous, and people of color, suffer the greatest health burden. Climate change discussions can protect health by addressing existing risks, preparing patients for the health impacts of a changing environment, and encouraging stewardship of the natural world. But often there's a gap between the desire to talk about climate change and our comfort with the topic. In my experience, climate conversations can be easy parts of a regular dialogue about safety. For example, when I talk to my patients about the risks of smoking, I can then also talk about their increased risks from poor air quality due to wildfires caused by climate change. You don't have to be an expert in climate science to open a conversation. Through simple discussion techniques, healthcare providers can plant seeds of safety. This video will explore the structure of successful climate change conversations in 3 parts: on-ramp, dialogue, and off-ramp. First, my colleague, Dr. Taj Mustafa, Associate Professor of Medicine at the University of Minnesota, will demonstrate these strategies. In the following modeled conversation, the doctor has an established relationship of trust with the patient, and they use the conversation structure to connect the personal to the environmental and to the global.
Perfect. Well, your lungs sound completely clear. That's great.
I have phlegm in my throat when I wake up every morning, though, and my nose is still running, even though I'm using the spray. It's weird. It feels like my allergies have usually cleared up by this time of year.
Yeah. Have there been any changes to your living situation?
No, I haven't moved. I still don't have any pets.
Well, pollen's your big trigger. And with rising carbon dioxide levels, the pollen counts are getting higher too. Carbon dioxide acts like a kind of blanket around the earth, which traps in heat and creates those rising temperatures, which also creates a longer pollen season.
I get that the climate's warming, but Minnesota hasn't really been affected yet, has it?
Yeah, sometimes in the middle of winter it doesn't feel like it, right? But temperature is rising in Minnesota, and that has resulted in higher average temperatures in the winter, but also a longer pollen season. Ragweed season is 3 weeks longer than it was 25 years ago. But it's not just what's happening here. Things that are happening elsewhere also affect us. The wildfires in California and Canada, those are happening more often. And you remember the last time it was really smoky out, we talked about limiting your outdoor activities and really planning to stay indoors. No matter where you live, climate change affects you.
So, wait, is my allergy just gonna keep getting worse and worse? Like, how am I supposed to live my life?
Well, that's why you come to see me. So we're going to take a look at your medications today and probably make some adjustments. There's lots of things we can do to control your symptoms, but there's things that you can do too. So when you think about planning your outdoor activities, being mindful of what air quality is like. As a rule of thumb, after a rainstorm is a great time to plan to go outside because pollen counts will be lower, so will other particulates. And as you plan group activities, thinking about air quality is going to be appreciated by everyone in the group. You're not alone. We're all dealing with this together. A lot of patients also find it helpful to be a part of a community of other people who are concerned about how climate's affecting their health. If you're interested, I can point you to some resources for further learning and potentially even ways to get involved.
Yeah, that'd be great. Thanks.
Let's dissect this conversation, starting with the on-ramp. The goal of these dialogues is to show patients why climate change matters to their own health. Dr. Mustafa began with an on-ramp, a natural entrance in the conversation that ties an environmental impact to health. In this case, she started by asking about the patient's allergy symptoms, one of the factors that could connect to a climate health dialogue. Other on-ramps include respiratory concerns, heat illness, vector-borne diseases, water-related illness, and mental health. A recent extreme weather event also makes a great conversation starter. Providers should also consider the patient's livelihood. Do they work in construction, roofing, landscaping, or farming, where climate-caused heat or flooding could pose additional risks? Even when a patient is being seen for a routine annual physical, their hobbies, interests, and lifestyles can be used as on-ramps. For example, air quality can impact their recreation choices and tolerance. If they like to hike, camp, or spend a lot of time outdoors, risks for vector-borne diseases should be discussed. Discussion of these topics can merge seamlessly into the next step, the climate dialogue. After establishing a health topic, connect health to an environmental trend related to climate change. When Dr. Mustafa's patient described worsening allergies, she connected his symptoms to the longer ragweed season. Then she introduced warmer temperatures due to climate change as the root cause, step by step, moving from the personal to the environmental to the global. Climate change is complicated. Metaphors can help explain the science in an approachable way. One such metaphor used by Dr. Mustafa was the heat-trapping blanket, which described the effect of greenhouse gases on the earth. Because most patients understand what happens when you pile on lots of layers, this metaphor shows how greenhouse gases act like too many blankets in the atmosphere, which trap heat and lead to changes in our climate. The off-ramp you choose depends on the patient. In the dialogue we just observed, the patient expressed anxiety about worsened allergies, so Dr. Mustafa redirected towards strategies that empower a patient to take more control with positive action instead of falling into despair. With an activated patient, your off-ramp could be suggesting resources for further learning or ways to get involved with groups that support climate change mitigation or adaptation. Lastly, we'll see a modeled conversation with a patient who does not feel comfortable discussing climate change and how the doctor responds.
All right, your vitals look good. So, how have you been managing your diabetes, especially with this heat?
The heat's been terrible, but what does that have to do with my diabetes?
Well, when you have diabetes, you're actually more prone to dehydration and even heart problems with extreme heat. That's why it's important we come up with a plan for how you're going to do.
I've never missed a day of work because it's hot outside. I don't see how this is an issue.
Yeah, I know you're really committed to your work, which is fantastic. And I want to make sure that you're able to do your work for as long as you want to. And that's part of why it's important that we come up with a plan to just keep you healthy. You know, there's a number of risk factors that you have. In addition to your diabetes, right, you have a very active outdoor job in construction and you work in the city, which is a warmer place than the rural areas. You know, the climate is changing and the temperatures are getting warmer and warmer, and we're going to have more days of extreme heat near in Minnesota, which is why it's important we come up with a plan.
The climate's been changing since the beginning of time. A few hot days a year isn't a problem.
Yeah, you're right. I mean, the temperature has been changing throughout time, but you know, in all of recorded history, we haven't seen the temperature climb the way it's been climbing. Again, my concern is for your health. I just want to make sure that you're able to do what you want to do and stay healthy doing it. That's why we really need to just come up with a plan for how you're going to handle heat. What precautions do you take when it's hot out?
Carry a water bottle around with me.
Oh, great. About how big?
Probably about like that.
Okay. How often do you fill it?
Every 2 to 3 hours.
Okay. Would it be possible to carry like a big jug of water instead?
How big of a container are you talking about?
At least 64 ounces. And I know you push yourself sometimes, so are you able to cool down when it gets too hot?
Yeah, there's shade structures on site, and that's where we take our breaks.
Fantastic. I know you really like the crew that you're working with, so it's also a good idea to kind of watch out for your team too. Make sure that they're staying well hydrated and taking breaks as well. Right? We're all in this together. So let's take a look at your glucose diary and see how your sugars have been doing.
Okay.
Even with this patient's reservations, Dr. Mustafa conveyed concern for his health and safety. She planted a seed for later consideration while taking steps to protect the patient during extreme heat events. Because the patient seemed unreceptive to climate information, Dr. Mustafa refocused on shared values like protection of health. Sharing the facts is necessary, but patient comfort and trust is most important. Depending on the specific relationship with the individual, You may need to change lanes sooner to maintain a positive interaction. If possible, try to discover the root of the unease while making it clear you both have the same goal, protecting their health. Today we learned about the structure of climate change conversations in a clinical setting. Through an on-ramp, dialogue, and off-ramp process, patients become connected to a global issue and are better prepared to protect their health in the face of climate change. While these discussions can feel daunting at first, they've worked before. During the tobacco crisis, healthcare providers educated the public, which improved health and saved lives. We are in an urgent, life-threatening climate crisis. As trusted voices, we must speak up to protect the health of families, communities, and the planet. Action starts with education. Together, we can make the changes that heal.